Carolyn, how you doing?
Hi, I'm good. You can call me Carrie.
Carrie. All right, I will try to remember that. The bottom of the screen says Carolyn, so if it
I
says,
know it's my work name.
all right, Carrie, good to see you. Where are you from?
I'm from the suburbs of Philly.
The suburbs of Philly, where everybody's rejoicing right now, thinking that they've got a World Series
Yes.
crown and a NFL title coming their way.
Hopefully.
Yeah, well, being a Cardinals fan, I'm not as happy. But we've got somebody else we've got several other people who should be signing on, so I'm going to
Okay.
give them a few minutes before we jump in. Adana, can you hear me?
Yes, I can. Yep.
All right. Where are you from?
Scotland.
Say that one more time.
Scotland. Glasgow.
Glasgow, Norway, or Glasgow, Ireland.
Scotland.
Sorry, Scotland.
That's okay.
All right. I just actually spoke to my second Scotland client yesterday. So, um, just so you guys know, this is going to be recorded. And what I'm going to be doing is sending it out to the 7 or 8 people who signed up for this. So, Carrie, if you don't want to be on screen, feel free to remove yourself. But otherwise, you're going to be seen by the 7 or 8 people. And that's it. I'm just going to send it out to those people. It's not going to be made public. So if you want to stay on, that's fine. If you want to take off, I totally understand. We've got a couple other people coming in, and then what I will do is I will start. My big goal is I want to be able to get done with my presentation with about 20 minutes left so that I can answer questions and show you a couple things by then. Mickey, can you hear me? Okay, nope, you're muted, and that's totally fine. And I'm going to ask everybody else to mute yourselves once I start. And I don't know, Mickey, I don't know if you heard, but this is going to be recorded, and it is being recorded now. So if you don't mind your picture being on screen when people see the recording, that's totally fine. No pressure, you can stay or not stay. But if you do stay, I'd ask a massive favor that if something goes wrong with my sound or something doesn't make sense, if you can wave so that I know something's up. Perfect. All right, I'm just going to wait a couple more minutes because we did have about 7 or 8 people, I believe, signed up for this. So I don't want them to miss out just because they had difficulty signing in. So I will give them a couple minutes. But basically, the outline of today, you should have seen it. But what we are going to be covering is, number one, I'm going to be telling you why you're still suffering with what you have. And I know you're thinking, how in the world do you know? But when you hear my answer, you'll go, all right, he does know. Number two, I'm going to be covering why most of the treatments that are prescribed and that you are probably doing are mere Band-Aids approach to the problem and not really things that are actually handling the problem and why you're not getting relief. All right. So my big goal is I want by the end of this for you guys to know why what you're doing is not working, and hopefully the best course of action you need to be taking in the future so that you can make sure that you're getting the relief and the long-term relief that you deserve and desire. Number three, we're going to be talking about the best exercises for your condition. And no, I'm not going to be giving you a full program for the $10 just simply because I couldn't, and you wouldn't be able to understand all the ins and outs of it, even if I did. But it's just going to sort of give an outline and sort of give you an idea of why the exercises you are probably doing right now are not as effective as they were promised by whomever gave them to you, and what you need to be looking for in the right exercises. I believe it's fourthly, fourthly, we're going to be talking about 3 things that are required for your body to heal. And this is universal for anybody with any type of musculoskeletal problem that does not require surgery, like a fracture or a tear or something that just does not need to have surgery to be healed. And lastly, we're going to be talking about what you should look for in a healthcare provider. All right, does that make sense? So I'm going to jump right in here. And if I'm looking off to this side, it's because that's where I have the people who are signed in, and it will also show me if anybody else is wanting to be allowed in. So I will be checking that on occasion. If you guys have questions, I'm going to be happy to answer them at the end. I'll have about 20 minutes. Also, you can feel free to write them in the chat below if you think you're going to forget it, because I often listen to things and then by the end of the presentation, I forget what I was going to ask. So feel free to write them in the chat box below. On the bottom of the screen, you should have a chat box. You can type it in there and I will get to those right after I'm done presenting. So thank you for coming to my sciatica pain relief class. Thanks for showing up, because more than half the people did not, but that's okay. You and they will both be getting a recording of this, hopefully within the next couple hours after the class. It all has to render, then I have to get it all set up and then emailed out. So big question, why are you still suffering? And real simply and understandably so, number one, you're probably getting the wrong treatment. Because if you had the right treatment that was going to handle the problem that you had, you probably you would have been feeling better by now if you had the right treatment. Number two, if you're doing exercises, you're probably having the wrong focus. The exercises are the wrong focus. The exercises are basically wrong. Because if you are getting what I was taught in school and what most people get taught as far as the greatest exercises for sciatica relief, most likely you are either stretching and working on that painful side and restricted side, or you have a therapist, chiropractor, trainer, doctor who say, no, you can't just work one side. You have to work both sides so that you work things evenly so they stay even. Here's the problem with that thinking. When you have sciatica, and we're talking one-sided sciatica now, if you have sciatica or piriformis syndrome or low back pain or butt pain or hip pain on one side of your body, the natural response of the body is going to be to compensate for itself. So the body's going to want to protect the area where the problem is, which means your body is not going to be balanced right side versus left side, simply because the side of the body that's aggravated is going to want to protect itself. It's going to tighten down. It's going to get stiff. It's going to get sore. So if you're working both sides evenly to stay even, you're not bringing anything back into balance. You're just, number one, stretching the good side, which, hey, is nice and loose and relaxed. And then you go to stretch the bad side, or vice versa. And you go to stretch the bad side, and the bad side is going to fight against you. It's going to cause more tightness. I tell people, think of it like this. If the side of my head was sore and I went to a doctor and the doctor said, Dean, I want you to do this 25 times, 5 times a day, and come back in 2 weeks and tell me how you feel. Most people would say, that's ludicrous. Why would you want to pound on something that's already sore, thinking that the pounding that you are going to give it is going to unsore what's already sore? And you're right. In the same way, why would I want to take something that is tight and irritated and sore and go make it tighter by stretching it? What's the difference between doing that to a tight muscle or this to a sore side of my head? If you answered nothing, it's both ridiculous. You're absolutely right. So that's why I never allow anybody to stretch or dig on their painful side. Under very, very few circumstances are they allowed to exercise the painful side. And that exception is if there's no discomfort, if it doesn't aggravate anything, and it's more comfortable than the non-painful side, which is very rare, but it has happened on occasion. So I always like to give the caveat that there are always rule breakers to rules. Okay. So far, why are you still suffering? Number one, you have the wrong treatment or the wrong treatment approach for your problem. Number two, you have a wrong focus of the exercises that you're doing. And number three, you're probably covering up your symptoms with medications. And we're going to be covering medications as a Band-Aid approach in the second section that I'm going to be talking about. But the bottom line is, if you are taking medications and covering up and masking the actual pain or problem, and I don't care whether it's an anti-inflammatory, a muscle relaxer, anti-inflammatory, muscle relaxer, pain medication, or one of the nerve pain relievers, nerve-focused medications like Lyrica, gabapentin. There's several other ones that my mind is totally blank on right now, but you get the idea. If you are artificially decreasing your pain, and I am not against pain medications, I am not against anybody getting out of pain, because that's what I want to do. I want to do that for the long term and teach you how to get yourself out of pain. But if you are masking your pain with any type of medication, whether legal or illegal, you are covering up what's actually going on. And it's sort of like me shooting myself with Novocaine on this side of my head that's sore, doing this to myself saying, look, I don't have a problem. But what happens when that medication wears off? That problem is now more intense, more of a problem, because I just aggravated the underlying problem that was being masked by the drugs. So in the same way, if you have a herniated disc, a bulging disc, a pinched SI nerve, or anything else that's causing your sciatica, and you're taking a medication that's artificially calming down your symptoms, you have no idea. Actually, you do. If you start doing things that typically are very painful for you, but you're going, hey, it doesn't hurt because I'm on medication, you are probably aggravating the problem in the same way as me doing this would be aggravating my head, even if I had Novocaine shot in. Hope that makes sense. So why most treatments are merely Band-Aid approaches to the problem and may give you some temporary relief, but then you come crashing down and you get frustrated all over again. And that's why so many people roller coaster and say, oh man, I've dealt with this before. Here's what I did before. It helped. And then it comes back a few weeks later, a few months later. And what I generally see is people's sciatica symptoms on occasion can just come out of the blue, first time ever, never had any issue like my wife did about 5 years ago. Just, she woke up one morning and just said, it's killing me from my butt to my heel. Being the sensitive, kind, caring, loving man, I laughed because I thought she was joking with me, knowing that I was specializing in sciatica. And I go, yeah, right. You got it down. That's awesome. And she stood up and started shuffling like a 90-year-old woman. And I went, oh my gosh, you're not kidding. She goes, why would I kid you about this? I thought she was being funny. So it can come on out of the blue for no reason. But typically, in my experience, what I have seen for the most people generally have a little bit of a backache here and there on occasion. No big deal. They'll pop a Tylenol or an Advil and it's gone. And maybe a month or a couple months later or the next year, they have another problem. It may last a little bit longer, a little bit more intense, but really no problem. And they generally have a progressive type of symptom going on that could be months, years, decades. So that's not uncommon. But the reason and the things that we do are generally Band-Aid approaches, such as medications, because medications, I don't care what they try to sell you or tell you, the medication is not healing anything. It's just masking and covering up the problem. In the same way that an athlete may have tendonitis in their shoulder and they keep shooting it with cortisone so that they can get back on the field or court and play, they're not doing themselves any favors because they're artificially calming down the symptoms so they can move and have their full movement. But by continuing to do the things that aggravated it to begin with, they're aggravating it further and further, and eventually something's going to give. All right. That's what medications do. That's what bracing does. That's what those skin creams do, that even though they may give you some temporary relief, the skin cream basically is a skin reaction, and you start feeling it on your skin, or it may be an anti-inflammatory medication that penetrates a little bit and has the same effect as a medicine. But usually the Bengays, the Icy Hot, the Tiger Balms, those are skin deep. They don't really penetrate at all, but you get a reaction on your skin, which confuses your brain because now you've got this burning on your skin. So it takes away the focus of your brain on the real problem. Injections, just like medications, they're temporary fixes. TENS units, they're awesome to block your brain because a TENS unit stands for transcutaneous electrical nerve stimulation, TENS. And what we're taught and what is known about them is as you turn them on, very superficial because it's transcutaneous, so right along the skin, it's going to stimulate you so your brain is confused on what's going on. And it also temporarily, while it's on, blocks the pain response in that area. So you get the tingling sensation, and you get a pain blocking response to the nerves. So it can feel like you have no pain. You're just masking the problem because when you take it off and you stop blocking that pain response, the pain comes back. Dry needling, something that I used to do to my clients because you know what? You can get some great relief when you get those muscles to relax, but it does nothing long-term because it's not healing anything, okay? So I consider these all Band-Aid type approaches because you're really not handling the underlying issue that's causing the problems. It may feel good, but can often lead to prolonged issues. In the same way, if you've got a scab on your arm on a cut and it's itching, what do? You scratch it and it's like, oh, relief, because it feels good. What happens when you look down 10 minutes later? That scab is peeled off. There's more blood on your arm. You start that whole process of healing all over again because you just ripped the scab off, even though you made it feel good by scratching it because it itched. So all these things do not put your body in an ideal position to heal, because what they're doing is they're masking the problems, making you believe that you're feeling better. And most people wind up doing things that are triggering their underlying problem without realizing it. That's why so many people have to change medications, because what once worked now doesn't work then. What they often have to do is wear the TENS unit longer, wear the brace longer, or take higher dosage of the medications, because what you were taking before is not enough to cover up all the irritation that you caused when it was feeling good under this amount of dose. So now if we double the dose, you feel good again. And what do? The same thing over and over and over again, which aggravates it. And so when it wears off, it's like, oh no, now we need more. All right. So number 3, the best exercises to do for your condition. Number 1, exercises that are best for you are ones that balance out imbalances in the body. Okay, now what do I mean by an imbalance? Well, most of you have probably seen somebody walking around on somebody who has been walking around on a really bad sprained ankle. Their body's doing this, all because of their ankle. And why is that? One reason, 2 different parts of your body. Number 1, and the only reason is because your body wants to compensate and help protect you from further damage. That's what our bodies were created to do. Our bodies were created to heal themselves. And in order to heal itself, it's got to protect from further injury. So if somebody badly sprains their ankle, like I did in college, the muscles around that ankle are doing this. The bottom part of my leg did this to tighten down to help avoid any further damage to that ankle. And then what does that do? That knocks the bottom part of that leg out of commission. So not only do you have the pain in the ankle, now you have the bottom part of your leg not doing what it was created to do, which means in order for you to function, the rest of your body has to make up and compensate for that bottom part of the leg. In the same way, if you have a low back pain, if you've got sciatica on one side or both sides, your body is going to be compensating, whether you recognize it or not, to try to help minimize pain. And so you've got this pulling over here, this pulling over here. Your body is out of balance, right side versus left side. And if you're not addressing those imbalances, all that extra tension from all the extra stress from the imbalances, it is going to affect your body. And most of the time, when you have extra stress in your body, the area that is most susceptible to that stress is the area that is the weakest and the most susceptible to injury, which is your problematic area. So it's sort of a double whammy. Your body's compensating to help protect you, but at the same time, it's stressing the area even more, causing the area around it to tighten up and protect, which is causing more imbalances. And so it's a cyclical problem. Some people call it the pain spasm cycle. Some people just say, hey, you know what? I know what happens in your brains when all this is going on with sciatica. You're thinking, if I just cut it off, it'll be fine. What can I do to knock this out? If I can just get comfortable. I'm trying to think of the things. The second night that my wife had this, I literally woke up to her and she just started talking. I said, hold on one second. Hold that thought. She goes, what are you doing? I said, I want to write this down. This is gold. And she goes, what do you mean? I said, just forget that I just said anything. Just go. And she said, if I could just get comfortable, I know I can calm this down. If I could just find a position where I can sleep, if I get some sleep and rest, I know I'll feel better. If you would just cut this off for me, I know it'd help. There were like 10 things that she said. And I'm like, and this is gold. And she goes, what are you talking about gold? I go, I guarantee you everybody else who's had this problem is going to say the same thing because it's so debilitating. So I get it. I understand. So the best exercises, ones that balance out the imbalances in your body, because if you have this tension going on and you knock that out, guess what happens to the area of your body that's aggravated? It will calm down and the tension will ease and your body will be put in a better position to start healing. Number 2, if you're working the painful side of your body, you're doing the wrong exercise for you. Because if you have something that's tight and irritated, and you think the way to loosen up a tight, irritated muscle is to pull on it and make it tighter, there's no difference between doing that and me doing this, thinking that that head is going to ease if I just keep pounding it. Okay. So the best exercises work what feels good and eases tension in your body so your body can start balancing out right side versus left side. So you ease the tension and you put your body in a position to heal. All right. And that's what I've learned over my 30 years as a physical therapist, because the first 15 years as a physical therapist, 20% of my clients thought I was a miracle worker. My 20% of my sciatica clients thought I was a miracle worker because I was giving them the cookbook approach, which was stretching the painful side, doing this abdominal strengthening, the pelvic tilting, the bridges, the press ups, stretching out the hamstring, stretching out my piriformis, doing 99% of everything to the painful side because that's what I was taught. And if you go online and look at all the exercises, that's what everybody still teaches because they haven't learned that, hey, 20% success rate is not acceptable in my book. But I honestly, the first 5 to 10 years when that was happening, I was assuming, because I was just an arrogant young punk at the time, that the people who weren't getting better, those 80% just weren't listening to me. Because obviously if I was helping 20% and they were doing everything I was telling them, obviously the problem was not me, it was the 80% of the people who weren't doing what I was telling them to do. Until I realized that, wait a second, by working the painful side, by stretching what was painful, by digging on what was painful, it was a miracle that 20% of people were being helped. But for some reason they were. So when I realized this and I actually stumbled into a class that started teaching me 180 degrees opposite of what I had learned in school, I started applying those principles and all of a sudden my success rate with my sciatica clients went through the roof. I mean, it went from 20% up to 60% in a matter of weeks. And honestly, ever since I've been doing stuff online, the success rate has been between 95 and 98% when people actually follow through with things. So I know what I'm doing. I've helped thousands of people in my career, and I'm trying to get as many people to understand, hey, if what you're doing is not working, please stop, because the definition of insanity, basically, if you keep doing what you've always done, you're going to keep getting what you've always gotten. Actually, the definition of insanity is doing the same thing over and over again, expecting different results. So stop doing what you've always done, because if you haven't gotten the results that you wanted, you're probably not going to get them by doing the same thing again. Next, I want to talk about the 3 things that are absolutely required for anybody's body to heal from any type of musculoskeletal problem. 3 simple things. Number 1, you have to drink enough water. And that means for everybody who's not in the metric system that you take your weight in pounds, divide it by 2, and that's how many ounces of water you need for your body to stay fully and adequately hydrated so it's functioning at its ideal level. Because we are 60 to 70% water. And if we're not getting enough water, our cells will not function ideally to help clean out inflammation and not help our body heal ideally. So number 1, you got to drink enough water. Number 2, you have to get enough sleep. Our bodies heal while we sleep. 7 to 8 hours a night, recommended, and is ideal number. And number 3, and just as importantly, and I've covered this kind of in what I've already said, number 3 is you've got to learn what your triggers to your symptoms are. What, and I use the mnemonic AMP, A-M-P. What amps up your symptoms? What A, activity, M, movement or motion, or P, position? What activity, movement, and position are aggravating your pain? Because just like this side of my head is not going to get healed if I keep doing this to myself, if you keep doing the things that are aggravating your problem, and I know you guys are going, but Dean, I have to sit. Dean, I have to walk. Dean, I have to lay down, and those are my triggers. Yes, I understand. We've got to find other positions, other movements, other activities to do, or do those positions, movements, or activities in a different way, find a comfortable position, do what we can to eliminate doing this. Because if we can stop ourselves from doing that, automatically you are going to start feeling better. It doesn't mean you're going to be healed, but if you can stop triggering the problem over and over and over again, you're already halfway there to calming down your symptoms. Hope that makes sense. Lastly, what should you look for in a healthcare provider? And I'm going to list out 4 things real easily and simply, and hopefully it's easy to understand. Number 1, You want to work with somebody who understands sciatica and its symptoms intimately, whether they've had it and recovered, whether they've known people, or whether they work specifically with people with sciatica over and over and over again. As a physical therapist, I was trained in the whole body from head to toe. I could work on people's jaws, their necks, their shoulders, their elbows, their hands, their backs, their upper back, mid back, low back, their hips, their glutes, their knees, their ankles, their feet. We're taught sort of as generalists. But if you're not seeing somebody who's a specialist, it's sort of like I always use the example of, if you've got a specific carburetor problem in your car and you've brought it to several general mechanics who fix it, and then within 2 weeks the same problem happens again, how long is it going to be till either number one, you look up a carburetor specialist, or number two, you get rid of the car and decide it's time for a new car because you don't want the headache anymore? Most people would start looking for a specialist in carburetors. Or if your transmission blows, are you going to take it to a generalist, or are you going to take it to a transmission specialist? In the same way, you want to find somebody who is highly knowledgeable and highly conversive in everything sciatica. And that can be a primary care doc, that can be whoever. But if you're going to do it right, so that you don't just spin your wheels. Number two, please don't go to somebody who just threw medications at you and said, hey, come back in 2 weeks. If it's not better, we'll change up the medication or change up the dosage or find a different medication that's going to help you better. Because like I said early on, a medication is a mask to the problem. It's not going to help the underlying issue going on. Number three, if you go to a physical therapist, a chiropractor, a doctor, a trainer, anybody who has a pre-printed handout. So sorry, someone else is about to sign in. A pre-printed handout of exercises for you, and they hand it to you, it's time to run. Because there's nobody out there who has the perfect generic handout of exercises that are made specifically for you, because it just can't happen. It's impossible. They don't know you. They have not assessed you. They have not assessed your imbalances. They do not know what helps you, what hinders you. And the generic exercises typically work either just the painful side of the body or both sides of the body. And if they're not going through and demonstrating and walking you through and telling you how you should be doing these, what you should be doing and what you shouldn't be doing, I would run as far as you can, as fast as you can, to find somebody else. Okay? Carrie, I see that question popping in, and I will get to that first when I start taking questions. And welcome, Monica. I'm just about done with the presentation, but don't worry, you are going to be getting a recording along with everybody else of this, but you'll be here for the questions and answers. So welcome aboard. And it looks like your camera's on, but either something is covering your camera or you're just black screening us, which is totally fine. You don't have to be on camera if you don't want. But I am going to mute you so that just in case there's noises around you, as always happens with kids or animals, we don't need to hear it until you have a question. And last but not least, and I already covered this, who should you look for in a healthcare provider? Someone who's a sciatica specialist, someone who's been dealing with sciatica, and that's pretty much all they do. And they've taken their practices and sold them and gone online and decided, hey, I'm going to help people anywhere I can around the world with sciatica. Not that you have to see me, because I guarantee you there's probably people locally to you who have probably dealt a lot with sciatica. And that doesn't mean, hey, you know what? Every sciatica client needs to come over here because I want to put you on a decompression machine. And for somewhere between $2,500 and $5,000, I want you to buy a package of 30, 40, 50, or 60 decompression treatments because that's going to heal you. When number one, they haven't done an assessment. Number two, they have no idea what's going on with you. And number three, how do they know that you need decompression? But trust me, I've been approached by many decompression machine salespeople to say, hey, how would you like to increase your bottom line? When I own my 3 clinics in Charlotte, North Carolina, how would you like to increase your bottom line by $10,000 to $20,000 a month? All you have to do is buy this, and we will guarantee that you will get X amount of patients you can charge them this amount, and this is how many treatments it will take. And I'm going, and I would ask them, how do you know the back pain patient's going to respond well to traction? Well, you got to trust us. And traction basically unloads the spine, so you're going to be giving them relief, whether it's long-term or not. And I go, so you want me to do something that may not give them long-term relief, but you want me to charge them between $2,500 and $5,000 to come into my clinic 40 to 50 times over the next 2 to 4 months? They go, well, that's what works. I go, well, it would work great for my bottom line, but it may not work great for my patients. And no, I'm not going to buy your machine. Well, no, you don't even have to buy the machine, because the clients that you will get from this will be able to pay for it, because your monthly income will be this. Here's how much your monthly charge will be from us. And by month 16, you will be free and clear and own it. And you haven't even paid us. You're just taking it from the patient. So I have a little issue with decompression machines. Not that people don't get better from them on occasion, but as a physical therapist early in my career, I honestly would put everybody on a hot pack and traction machine who came in with back pain, because who doesn't like to be nice and gently stretched? Some people like to be stretched a little bit more than gently, because it feels so good. Plus, having a hot pack underneath you, laying there for 20 to 25 minutes, who would not enjoy that? And I learned over the first 5 to 8 years of my career, everybody loved it, but the effect of those treatments most of the time did not last until they got home, and they'd get out of their car and they'd feel as bad as they did when they came in. And it was like, all right, temporary relief is not good enough. And so that's when I went on an all-out search going, all right, there's got to be a way to treat sciatica clients that's better than temporary relief, that will work in the long run. And my goal was, instead of having people coming to me to become dependent on me to get them out of pain, and that they needed to, hey, if something happened, they needed to come see Dean to fix them. My big goal was, wouldn't it be nice if I can educate people to have them become empowered to become independent so that they can take care of themselves? And that's my heart. And that's what I love doing, being able to train people, whether through my online course, whether it be through one-on-one consults or group consults, to teach people how to find imbalances in their body, how to fix them, so that whether they're having sciatica flare up, they know how to handle it on their own, or any other musculoskeletal problem. Because guess what happens when you sprain your ankle? Your whole body goes into compensatory mode and everything gets out of balance. And guess what happens when you balance things out? I've had people who have come in walking like a typical sprained ankle client who could barely put weight on their ankle, to, after 20 minutes of teaching them and showing them what they can do to their other leg and other parts of their body, walking out almost in no pain with hardly any limp. And it was kind of scary for me, because when I saw it the first time, I had to remind them, look, your ankle didn't just heal. We just balanced out all the imbalances in your body that's allowing you to put more weight on your ankle, because your body's not protecting it now, and you're able to function, which is great for healing on one hand, but very bad for healing on the other, because people start feeling good and they start thinking that their body's healed. But no, it takes an ankle 6 to 8 weeks to actually fully heal. So I've got to try to tell people, look, remember, this is a marathon, not a sprint. Just because you start feeling better does not mean you're healed. So please be wise. All right. I hope that all makes sense. I am going to jump into the question box, the chat box. Carrie wrote, is the best way to correct imbalances of the body to do exercise and stretches on the side opposite of your sciatic pain? How do you know where the imbalances stem from? Great question. I always tell people, don't stretch the painful side of the body, stretch the opposite side of the body if you have one-sided sciatica. But you've got to know where your imbalances are. So you've got to know how to assess where the imbalance is before you just think, well, Dean said stretch the right side of my body, so you make up your own stretch, or you do a movement that you have no idea if it's out of balance. So I'm going to show you 1 or 2 exercises here in the next few minutes to show just real simply how you assess some imbalances. And for those of you who want, I would love to be able to see more than one person on the screen, but if you guys are shy and don't want to be on screen, it's totally fine. It'll just help me get some feedback if I could see more than just Mickey, although I'm not opposed to just seeing Mickey. So, somebody tried to pop on, then popped off. So hopefully that answered your question, Carrie. But Mickey asked, what if your pain is on both sides? My MRI shows bilateral bulges and spinal stenosis. So Mickey, I need to ask you, are your symptoms all bilaterally? Everything is equal bilateral, or do you feel symptoms on one side? You can either hold up fingers or go unmute yourself. Either here, I'll unmute you. I'm asking you to unmute yourself.
My pain is on both sides, but not equal.
Okay, but according to your MRI, it should be equal, right? Because it's equal on both sides.
Well, doesn't it kind of ebb and flow in your discs?
You tell me. If it ebbed and flowed,
That was my understanding.
Okay, if it ebbed and flow on your disc, you would have one side be painful one day, the other side be painful another day, or certain movements would cause pain on your right side, while other movements would cause pain on your left side, and you wouldn't have it on both sides. Look, I'm gonna be straight out honest with you people. I hate MRIs. And here's why. My doctor says I got degenerative disc disease. That's why I have pain. And I go, well, that's interesting because 50% of 35-year-olds have degenerative disc disease, but no pain. Well, Dean, you don't understand. I've got a herniation, but my MRI says it's on my left side, but my pain's all on my right side. And I go, well, guess what? That MRI is worthless to you because if your problem's on your right side, the herniation's on your left side, it doesn't matter what the MRI shows because you should have pain on your left side according to the MRI. That happens more times than not. I actually had one of my good friends who's a physical therapist was having a stomach issue. They did a CT scan. Got done with the CT scan. They said, you need to go see an orthopedic surgeon. He's going, okay. Thinking, what in the world do I need to see an orthopedic surgeon for my stomach problems? So he goes and sees the orthopedic surgeon. He walks in and the orthopedic surgeon looks at him and goes, how are you walking? He goes, what do you mean, how am I walking? He showed him the CT scan of his back. He goes, this is the worst back I've ever seen. Look at this herniation. Look at this bulge. Look at these bone spurs. And the therapist looked, he goes, I never had any back pain, never had any radiating pain, never had any butt pain all my life. What are you talking about? And the guy goes, I was expecting you to come in a wheelchair. And that was my friend 17 years ago. To this day, not one day ever of back pain. And that was the worst CT scan that this back specialist orthopedic surgeon had ever seen. So I'm not against MRIs. I just hate the fact that people are not educated on what is a normal finding. And if your MRI does not correlate directly with your symptoms, well, here's another reason. Most people, when they get their MRIs, are laying down on their back, right? So Mickey, when you're laying down on your back, are you in a lot of pain? So those bulges and those pinches and all the problems that they found on your MRI were there, but you had no pain. So what good is it? Because when you stand up, I guarantee you what's happening from the laying down position to the standing up position, your discs are doing something totally different. And I would assume that it's bulging more to the side where more of your pain is, even though it may not have shown that when you were laying down. So you are not your picture, just like my good PT friend demonstrated, because he should have been crippled. And this surgeon was chomping at the bit to fix him and do surgery to help him. Not needed. And 98% of back surgeries are not needed. I know that'd get me in trouble with those back specialists, but it's just the truth. Anyway, Adana says, can you do Pilates and body pump? I sure can. It doesn't hurt me because I don't have a back problem. But if I had a client who had sciatica and they were doing Pilates, the problem with Pilates is you're doing both sides evenly, right? Working both sides evenly because you need to stay balanced. The problem is when you have a one-sided sciatica problem, your body's compensating and your body is not even. Things are pulling out of balance. And if you are trying to stabilize and strengthen things when your body's out of balance, guess what's going to happen? You're going to reinforce those abnormal muscle patterns and hold yourself in a stable position that is not very pain-free. So I would avoid it. Not sure what body pump specifically is, so sorry, but if it's working both sides, I would avoid it until your symptoms calm down. And I know physical therapists say, hey, you've got to learn how to do, tighten your stomach, get your abs tight. But I tell all my PT friends now, so when someone's in pain, you think if you just strengthen up their stomach, that is going to take their back pain away? I said, even though their body's out of balance, and when you're strengthening up their core, you're reinforcing that imbalance. And then I hand them the studies that show there's no direct correlation between core strength and less pain. I've had people with phenomenal core strength with severe pain, and I've had people with zero core strength and absolutely no pain. So there's no indirect correlation of increased strength, decreased pain, decreased strength, increased pain. It just doesn't exist. Now, I'm not against having a good, strong core, because if your body's balanced and you're stable in that position, guess what? You are going to be preventing a lot of problems. It used to drive me crazy when I would get a client come to my clinic who was rear-ended at 5 miles an hour and walked in like they were stiff and they couldn't move. Because in my mind, sorry, I'm a cynical, critical person, and I was thinking, obviously they're looking for a settlement, because getting rear-ended at 5 miles an hour should feel about like that. I mean, literally, that's what it should feel like. But then when I would do an assessment and they had no clue what I was doing, I always do assessments right side versus left side to assess their imbalances. They were usually the most imbalanced people I had ever seen and assessed. And then I'm thinking, okay, if this is tight here and this is relaxed over here, and someone hit them from behind and this is tight, guess what's going to happen to this side? Somewhere along your body is going to have to absorb all that extra movement that tight side is saying, So their body is going to have to do a massive rotation and stretching on their loose side instead of just going like this on both sides evenly if they were balanced. So there were some people who were faking and fudging things, and I can catch those when I do assessments. But a lot of them were actually just so far out of balance and had been dealing with other issues for so long that their body was just a compensatory mess, that any added shock to it just threw them way out of balance. All right. Once you start fixing imbalances, how long should you expect to notice decrease in pain and resolve in sciatica? Great questions, Carrie. I don't know if you saw the video that I posted yesterday in the group. My new Delhi dentist from India was gobsmacked that he was on my group coaching call the day after he started my program. He goes, look, I'm very superstitious, so I don't want to say anything, but in one day I feel 20% better. And all he did was 2 or 3 exercises to get them balanced. That doesn't mean he's going to stay that way. That doesn't mean he's not going to get out of balance if he triggers the problem again by doing things that triggers it that he doesn't realize. But I've taken people from a 9 out of 10 pain to a 1 out of 10 pain within 30 minutes. Once we get them balanced, the big problem is when you start feeling better that quickly, your brain says there's no problem. But like I said, a simple ankle sprain takes 6 to 8 weeks in order to heal. So imagine how long it's going to take a problem that's been lasting weeks, months, or years. So it can take time. My standing x-ray looks awful, says Mickey. So MRI aside, what would you recommend for someone with unequal pain on both sides? Where to start? All right. So there's a lot of other body parts that you can start at to find imbalances. And once I get through these questions, I am going to get you doing an exercise or two so you can see. And the worst pain is not always the same side. Okay, so things are shifting. And yes is your answer to the older we get, the less our discs actually move. I have no clue, I'm not even going to guess. I'm 56. And I know that my discs right now are a lot thicker and much less fluid, viscous. You know what? My mind's totally blank on it. Less squishy than it was when I was 40, 30, and 20. So the older we get, the drier our discs become, so they're not as pliable and movable. So yes, you are probably doing things. You might have a problem mainly on one side and the opposite side is compensating a lot. And maybe that's why you have pain on both sides. So it all depends. If MRIs are questionable, all right, I was waiting for this, then an X-ray, much less questionable because an MRI shows much more detail than an X-ray. An X-ray basically shows your bones. And by the way, how many of you have been told that your pelvis is either shifted, out of alignment, rotated, up slipped, down slipped? Anybody been told that their hips are uneven or their pelvis is uneven? Come on, because they have to be, okay? Anytime you have a back problem, a butt problem, a sciatica problem, the muscles on that side of the back or butt are going to do this. They're going to tighten down, which means you're going to get a little bit of a hip tip or a pelvis tip or a pelvis rotation one way or the other. And I do a lot of videos on this because someone goes to a chiropractor and they says, oh, your hips are out of line. If you start coming in 2 times a week for 4 weeks, we can knock that down. Then 1 time a week for 6 weeks, then maintenance. And I don't know about you, but the only time that this pelvis has moved since I started this was when I moved it. Your bones do not move, cannot move, unless obviously you have some type of trauma or your muscles say, hey, it's time to move. Now, if your muscles are out of balance, guess what's going to happen? It's going to cause shifting, rotating, twisting. It can make it appear like one leg's longer than the other because one of your hips might be elevated simply because the way the muscles are tight on one side of it, it could cause it to rotate forward, rotate back, up, slip straight, down. So just wanted to cover that. I finally have an X-ray scheduled in 2 hours, which has been a struggle to get. All right, Ethan. So basically, it's going to show you your bones in the alignment, and it's going to show how much space there is in between. So they might be able to tell you that you got some degeneration, or they might assume that there's a bulge instead of a degeneration. But I'm glad you're getting that done for some peace of mind, but it's not going to show an awful lot. And Adana writes, when I walk, all right, Adana and Ethan, your names are messing me up. I'm so sorry. I know one's a male and one's a female, but anyway, when I walk, pain shoots down the back of my calf and ankle. Very, very common. But Adana, we're going to test that in 2 minutes here, okay? So every time you walk, you get pain down that calf and ankle?
Yeah.
Perfect. Not perfect. I'm sorry. I'm not happy that happens. But here's what we're going to do. Everybody, I want you to sit on the, if you're sitting, I want you to sit on the edge of what you're sitting on. If you can't sit and you're laying, I want you to lay down with your knees bent, feet flat on whatever surface you're laying on. So sitting on the edge of your chair, couch, bed, whatever you're sitting on with your feet flat on the floor.
Mhm.
What I want you to do. All right, Adana, I want you to sit though.
I'm sitting.
Oh, sorry. I saw your shirt. It looked like you were standing. I'm sorry.
Sitting.
You Scottish people sit funny, that's all. All right. So what I want you to do, cross your arms over your chest, and I want everybody twist as far as you can to your right side. And then twist as far as you can to your left side. Does one direction feel easier, looser, more comfortable, less restricted than the other? Does everybody feel perfectly even, or does one side feel easier? Whether it's stiffer, whether there's a little bit more discomfort, everybody should have one side that feels better, correct?
Yeah.
All right, so what I want you to do, the side that feels easier, I want you to turn nice and slowly to that side, nice and slowly 10 times to the easier, more comfortable side. Monica says, what is better, walking or riding a bike for sciatic? Monica, that is going to depend on each person. I can't give a definitive answer because I don't know what's going to hurt you. Some people can't sit. Some people can't stand. Some people can't walk. Some people can't sit in a recumbent bike. When you're done with 10 rotations, you're going to stop, take a break for a few seconds. And then what you're going to do, you're going to do 10 more to the same side that you just did. Everybody do 10 more to the same exact side. I can bike for miles, but I can't walk many steps. And everybody's different because the cause of people's sciaticas varies greatly. And even if people had what looks like an identical MRI to another person, the symptoms can be so different. So that's why generic exercises don't work for everybody. That's why you have to learn how to assess your problems and your imbalances and fix them. So now that everybody's done 2 sets of 10 to their more comfortable side, I want you to remember what it felt like going to the restricted side or the side that wasn't as comfortable. And now I want you to go back to that side and see how it feels now compared to how it did the first time. And what I want you to do is if it feels better, looser, less painful, I want you to give me a thumbs up. Does it feel the same? Thumbs straight, or worse, thumbs down? All right, just 1 or 2 times. All right, you guys are gonna be a challenge for me. All right, Adana, how about you?
I feel pain on my ankle.
Okay, so when you were doing the exercises to the good side, were you feeling the pain in the ankle too?
Yeah.
Okay,
Yeah.
so I should have said, and stupid me, if you were having any discomfort while you were doing the exercise, you need to stop right away. Okay, so what I want everybody to do, I want you to do 2 more sets of 10 to the easier side again, because I always do 2 sets of 2 sets before I move on to the next exercise, just to make sure. So the easier side. So for you, Adana, what you're going to do is I want you sitting on the edge of your couch, and I want you to straighten out your bad leg and put your heel on the floor. So your knee is straight and your heel is on the floor. Is that painful? Does that increase the pain in that leg?
No,
What happens if you take that foot and try to lift it up? Does that increase it?
no.
Okay, now I want you to bring that foot back and switch legs and do the same thing. So you guys are all doing 2 sets of 10 for a second time on the good side while Adana is doing this. Adana, does that feel equal on both sides? Are you able to lift the legs equally? Do they feel equal, or is there a difference?
There's a difference when I lift the right hand, I still feel it in the ankle of the left.
When you lift the left ankle, you still feel it in the left. When you lift the right ankle,
When I lift the right leg, I feel the ankle on the left.
when you feel the left leg, you don't feel it?
No,
All right, good. You are one of the exceptions to my rules. So you are going to take that left leg. You're going to lift it up and down 10 times for me, the painful leg, just as long as you don't feel it in the ankle this time, okay?
no.
So 2 sets of 10 for your left ankle. Everybody else who did the twisting, all right, just gets confusing when I start doing different exercises with people. But you people who did the twisting, you just did the second set, 2 sets of 10 again. Better, same, worse. Going to the opposite side. All right, so we went from worse the first time after to about the same as the first time. So it got better after doing the second set of 2 sets of 10 for both of you on the screen, correct? Because it was more like this the first time for both of you, right? You said it was worse going to the bad side. You're the same both. So nothing changed for you, Mickey? All right, and Carrie, for you, you went from this the first time to this the second time?
Yeah, I guess the harder side was just, it's more stiff.
Okay.
But it's slow, like it didn't improve drastically, but I think it's becoming less.
Okay, so Carrie, what I want you to do, you're going to go to your good side, hold it at the end range. Then what I want you to do is I want you to bounce 10 times at the end range on your good side, and then stop, and then do 2 sets of 10 bounces. And for you, troublemaker up in the corner of my screen, Mickey, we're going to do a different exercise for you. All right, so what I'm going to have you do, I'm going to have you stand up. And Adana, now that you got your second set done, go ahead and lift your right leg up and tell me how it feels. And guys, I'm just telling you, I've got 5 minutes before I have another call that I have to jump on. So I'm going to be jumping off promptly at 2 o'clock, which in 5 minutes from now. But everybody's going to get a video recording of this so you can watch it. So after you're done 2 sets of 10, Carrie, oh, you changed the name. I was going, okay, I need to remember the right name. Go ahead and go to the tight side again and see if that loosened it. And Mickey, I just want you to stand and I want you to tip to the right, tip to the left, and tell me which way is easier. More comfortable. All right, 2 sets of 10 to your left. Adana, when you lifted that right leg, did that calm down the,
Yep.
oh wait, Carrie,
It did calm down, yeah.
good. I want you to do 2 more sets of 10, Adana, on that left leg, the bad leg, just as long as it doesn't aggravate. Now, Carrie, how did that feel going back to your right side? Better?
That's looser.
All right. So by working your looser, more comfortable, less restricted side, I just loosened up the restricted side, which puts you more in balance. So the more balanced your body is, when do you usually notice your pain and symptoms? What activity, what movement, what position?
Sitting.
All right. How does it feel sitting now compared to what it did 5 minutes ago?
It feels good because the way I think I'm positioned at the edge of my chair and more upright.
So if you were to sit back, would you definitely notice it all the time?
Pretty much.
All right. So sit back and tell me if it feels any different. Sitting is usually the last thing that comes back. So I'm not looking for a miracle. But now, Mickey, after you've done 2 sets of 10, when you go back to your right, how does it feel? You're muted, so whatever you're saying, I can't hear you. I'm sorry.
I'm getting still the shooting pains down both legs, and it still feels the same. But I've been struggling this for months.
Okay, go ahead and have a seat, Mickey. Adana, now
Yeah.
when you lift your right leg, does it feel better?
A lot better, yeah.
A lot better. Good. Now go ahead and walk about 10 steps and come back, and let's see if we did anything. Carrie, how does that feel sitting back?
I'm not in extreme pain. I mean, I feel it, but I'm not where I need to.
Is it better than what it normally would be?
It could be, yes, possibly, yeah.
Okay. Mickey, it's going to take more work with you. I'm so sorry. Obviously, limited in time, and this wasn't meant to give exercises that are going to heal, but it was just supposed to show. All right, Adana.
Yeah, a lot better, yeah.
A lot better by doing 2 simple exercises to the side of your body that felt better. It felt a lot better to walk. How long have you been dealing with this?
6 months.
6 months. All right. Guys, I hate to do this. I've got to jump off in 2 minutes, but I hope this stuff made sense. I hope the things that I said were not offensive because I'm kind of blunt, but what I'm going to do is I'm going to email everybody a copy of this, and then also, if you're interested, I do initial video consultations with people for $50, and you get a money-back guarantee if you're not satisfied at the end. It is not an entire program on a 30-minute call. I wish I could do that. If I was that good, it wouldn't be $50, but it's just to go over a couple different exercises, see how we can find imbalances to try to show you how balancing out your body can and does heal over time. And obviously, I've got a do-it-yourself online course. I've got different coaching programs along with it that I offer. So that's what we would be talking about at the end to see what would work best for you and what you need and what you want. So there's no pressure. I just want to let everybody know. But thanks for jumping on the call. I hope would it be worthwhile to keep doing the exercise you showed? Mickey, yes, if there's definite difference, right side versus left side, and there's no symptoms with the exercises when you perform them. I don't allow any discomfort, any soreness with the exercises as you're doing them when I'm working with you, because otherwise you're defeating the whole, my mind just went totally blank on a simple word that I'm trying, the whole,
Purpose.
Thank you, purpose. Because as you are doing something that's painful, your body's going to compensate, throwing things further out of balance. So hopefully this made sense. It's been a pleasure. I do have to jump off because I have another commitment in about 30 seconds. So guys, take care. Thank you very much for joining.